Hey y'all, I am the LoudLilDucky. Today we are going to go over something I discovered while I was sick and in the hospital. I'm doing okay. I had to have a couple procedures due to a kidney stone, and I am back home, kind of resting. But I was going through my patient portal because I like to see my lab tests and review everything myself, because sometimes they don't necessarily talk to you about those things. But as I was going through old ones from about a year ago, I had discovered stuff. So I had a positive HCG after I've had a hysterectomy. And it's like, if we want to think in terms of Gingras or what Owens believed, should I question, was I pregnant? Because I had a positive P test. I had a positive HCG. In my mind, I have every right to believe that I was pregnant, correct? So let's go into HCG. HCG is human chorionic gonadotropin. It is a hormone for the maternal recognition of pregnancy produced by trophoblast cells that are surrounding a growing embryo, which eventually forms the placenta after implantation. The presence of HCG is detected in some pregnancy tests, HCG pregnancy strip tests. Some cancerous tumors produce this hormone, therefore elevated levels measured when the patient is not pregnant may lead to a cancer diagnosis, and if high enough, paraneoplastic syndromes. However, it is unknown whether this production is a contributing cause or an effect of carcinogenesis. The pituitary analog of HCG, known as luteinizing hormone, that's LH for short, is produced in the pituitary gland, of course, of males and females of all ages. So that is what HCG is. It is a hormone. A lot of times people call it the pregnancy hormone, but it is not just pregnancy related. Our pituitary gland and things like that, those also produce hormones. You've got your thyroids, all these different things that can cause different things. So we need to have a basic understanding of what it is, what are some things that HCG positives can mean, and who, when, where can it be produced. So when does my body make HCG? All people have small amounts of HCG in their bodies, almost undetectable levels, but they have them. Your HCG level rises fast and peak around 10 weeks of pregnancy. After that, they fall gradually until childbirth. In rare cases, germ cell tumors or other cancers may cause your body to produce HCG. We know that Owens does not have cancer. I do not have cancer. So we can rule out that. So everybody, male and female, can have HCG in their bodies. That's why if a man's HCG test comes back positive, because they will test it, with a man it's usually because of cancer. So far, no biologically born males have become pregnant. And I know a lot of us know how to do these things, but this is just a basic video for anyone. Anybody that wants to search up about HCG and different things about it, I want this to be informative. But how do you test for HCG levels? HCG can be detected in either blood or urine, which we know. However, a blood test is more accurate because it can detect smaller amounts of HCG. That makes a lot of sense, which is why we do the pee stick, and then they will go and confirm it with a blood test, usually, for pregnancies. And if they don't even do that, because usually they'll look at it just to see if it is good, but sometimes if they can confirm it by ultrasound, they may not send off an HCG, but they usually like to at least have a base, because it at least tells, especially if you're not very far along and can't have an ultrasound because it's so early in the pregnancy, they at least have a level about where you might be, or is it a growing at a normal rate? Is it maybe ectopic? The blood test can at least give them a baseline of where things are, or hey, it does look like that you're pregnant, but your HCG levels are not going to be, this baby isn't going to end up being a viable pregnancy. Like, you're going to lose the baby, or you are losing the baby. It also, a lot of doctors will order it maybe just to see if there's a miscarriage happening, to see if levels have dropped and where they're at there. But it says there are two different types of blood tests to detect HCG. A qualitative test detects the HCG is present in the blood. It doesn't specify the amount, just that there is HCG. So we have seen this, and that is where it says, positive or negative. And it's HCG positive. HCG or pregnancy test is negative. That's just a positive and negative test. Then you have the quantitative test, or a beta test, and that measures the amount of HCG present in the blood. The results are in milli-international units of HCG per milliliter of blood, MIU per ml. And this is where we get that number, 102, 104 in Owen's case, or like the tens of thousands and things like that. I have on my community page, I have a picture of my daughter's who, when she was pregnant, what her HCG level was. And then we know from looking at the doctored form of the HCG test that Owen sent to Owen or Neil or Reality Steve, maybe both, but she didn't submit that doctored HCG test to the court. She submitted the 102, 104 one. So there's a qualitative and a quantitative. Quantitative, quantity, numbers. An at-home pregnancy test will be positive if HCG is detected in your urine. A urine HCG test is performed by either peeing on a chemical strip or placing a drop of urine on a chemical strip. At-home urine test analysis or urine tests typically require higher HCG levels to return a positive. So my HCG test that I took was not an at-home one. So I don't even think that if I would have peed on a stick that it would have given me a false positive if it needs higher, because mine were not that high. All right, so here are my two tests. I have my name redacted at the top, but we have an HCG qualitative, which was ran on July 16th, 2023 at 12:11 a.m. That one came back positive, but it was abnormal. Probably because I shouldn't be pregnant. And so they did an HCG quantitative at 12:32. They got the positive and they're like, okay, maybe we should get the number. And notice my qualitative was a urine. I like that they say the normal value is negative. Depending on what you want your normal to be at that time, I don't think that matters. This one says a 6.0, which is high according to this, which, a 6.0 is not high. So, should I, at this point in time, believe, and I'm going to put myself in Owen's situation. I see these tests, I get these test results back, knowing I have had a hysterectomy. Let's not even go into whether I have even been intimate with anybody or anything like that. We can go into that too, because, well, I hadn't. And so, but let's just go for the fact that I've had a hysterectomy. Should myself be like, what in the world? I was pregnant. How was I pregnant after I had a hysterectomy? I had my tubes tied even prior to that. How did I end up pregnant? You know what? I'm going to sue the hospitals. I'm going to sue the doctors. Because in my mind, I believe, based on a P test, my HCG, that I was pregnant. We don't need to believe any of it doesn't matter about all the other stuff, right? That's what Gingrich says. If you truly believe, like I can't get in trouble for trying to sue the hospitals and the doctors that did my hysterectomy and everything like that to make sure that I didn't get pregnant. But because I've seen this test, I now believe that I was pregnant after I had a hysterectomy. And I can come up with all this different stuff, and I could say, yeah, I was intimate with somebody. Or am I going to be the virgin ducky? Like, hadn't had sex around since then, like around this time. I don't have the parts to make a baby, but I have a positive HCG test, a positive pregnancy test. No, I should not go run and try to sue all these people and get a quick payday because I believed. I have one thing that says it, and I'm going to use it to get things. I'm going to use it to get a settlement. Because they're not going to want to go to court and all this stuff. Maybe they'll just give me a settlement. And all of the other stuff isn't going to come out. Obviously, no. So that's why the whole, if she truly believed, you can have a positive pregnancy test, but when you look at everything else that goes with that, you didn't have sex, you didn't do this, you didn't do that, is it actually reasonable to believe that she believed she was pregnant? No. All signs point to no. But this was just crazy to me that I discovered this during the time that we are talking about this case. I was like, holy crap. I was pregnant after a hysterectomy, according to a pregnancy test. That's how accurate these things are. But we'll get into maybe why I was positive for this. And it wasn't pregnancy. Keep in mind, a low-level HCG doesn't diagnose anything. It's a tool to detect potential issues. If your health care provider is concerned about your HCG level, they will test your levels again in 2 to 3 days. What did they not do in Owens? They did not retest her HCG levels because she never had prenatal care. Because at 102, they would have rechecked in a couple of days if she was getting proper care. But no, she's going to urgent cares. Or she's doctoring evidence that isn't real. She's not getting regular care or even going to the same urgent care. She hops facilities, hops doctors. Says then they will compare the results to get a better picture of what's going on with your pregnancy or non-pregnancy, depending on your case, basically. So, news flash, a positive pregnancy test just means you're positive for an HCG hormone. You got that, Owens? It doesn't mean you are positively, without a shadow of a doubt, pregnant. It just means you have the HCG hormone in your system. Obviously, we have types of pregnancy tests. We've got the urine pregnancy test, which is a primary pregnancy test, and there's the detects HCG presence. Pregnancy blood test, mostly used to confirm a positive urine test, detects HCG levels. A transvaginal ultrasound, used to measure embryo development and rule out complications, which wasn't done. And you can have an outside, you can have on the belly or in the VJ ultrasound to measure these things. Those things weren't done in this case. But we have the first one. Lots and lots of urine tests and HCG detected for some reason. In my case, and in Owen's. How do pregnancy tests work? Men, this might be learning for you. Women, it's nothing for you. For the most part, we've all looked at these and done these. But it's got a simple pad, antibodies, a test line, and a control window. And this is the clear blue, which is a brand name. It says the simple pad absorbs the urine. If a woman is pregnant, then HCG will be present in her urine. The antibodies. If you are pregnant, HCG will bind to the mobile antibodies in this test, which are attached to the blue dye. So we're going down the test to how we get to our test line and our result window. If you're pregnant, the immobilized antibodies in the test zone attach to the HCG, which is attached to the blue dye, and form the positive line. If there is no HCG in the urine, i.e. not pregnant, no line will be formed. In the control window, the excess dye antibodies that are not attached to the HCG will flow into the control area. This area contains antibodies which will recognize the dye antibody complex and will bind to it. This causes the dye to form a control line to show the test has worked correctly. So the thing with the dyes too on these tests is, if you get them wet, which urine obviously is going to get them wet, sometimes that can cause dyes to show up or look like they expand a little bit. So sometimes there are those faint lines, sometimes it's not. But if you are in fact pregnant without a shadow of a doubt, these lines are not going to be where you can't see them. They're not going to be so faint, invisible, like, oh, I can kind of see a line. No, they are going to be in your face, loud. Very loud. Bam, boom. Not going to be a little faint line. If you can barely see it, you need to wait a week and take it again or go to the doctor. That is one thing I have so tired of seeing in like certain Reddit forums, because I had joined one on something, but I am so tired of seeing all these stinking pregnancy tests on Reddit forums that is like, does this look like I'm pregnant? Call a doctor. Go to a doctor. Stop posting this BS. If you have to ask Reddit, you have a problem. Like, Reddit is not the answer, and no, you're not pregnant, okay? If you have confusion, please call somebody. Call an OBGYN. Go to Planned Parenthood. Stop asking Reddit. I don't want to see any more pregnancy tests on there. Can you see it? No, it's invisible. I can't see it, not even in 4K. Smoking tobacco and using marijuana can increase HCG levels too. I thought that was very interesting because they were using gummies the night that this happened, right? The incident, May 20th. And so could that have increased the HCG levels? And the fact that smoking can. Now, I smoked last year when I had a positive pregnancy test. Do I think that was the reason for it? No. There are also several medications that can affect test results. They include heparin, diuretics, promethazine, which is like Phenergan, anti-seizure drugs, which is what Owens is supposedly on, some anti-nausea medications, which is what promethazine is, hypnotics, and antipsychotics, so anxiety and depression medicines. This is where I think at this point where mine got a positive result, because at the time they may have given me Phenergan for something being nausea. A lot of places, at least where I'm at, they've more switched to Zofran and not Phenergan for many, many reasons. They're really harsh on the veins. They have more side effects, drowsiness as opposed to non-drowsiness, and so forth. So I had some nausea medicine for sure, and I was on Sertraline, which is Celebrex or Cymbalta, one of the two. I don't remember. I am not on that anymore. There was just a lot of stuff going on in life. It was more stressful than normal. Prior to my daughter getting pregnant, it actually died down when she got pregnant, which is very weird. But anyways, so I think one of the medications that I was on for my anxiety, depression being through the roof or on the roof, let me know if you know what on the roof is. That is the cause for my positive HCG test. Or it could have just been a bad lab test, contamination, something like that. Something got mixed up. That could have been the thing. So we have marijuana can increase HCG levels and anti-seizure meds for Owens. That could be the reason for it. But 102, just like a 6, I think I found a 25 or something too. I may have to go back and see if I can find that one. If I can find the 25 one, I'll put that in there too. This time when I went back, they did it, which, why do they do a pregnancy test on you if you've had a hysterectomy? They look at me and my age, and a lot of times it's just so natural that they just send one off, before you get any radiation and stuff like that. But they're so used to sending it for people of my age, women of my age, to make sure that they're not pregnant, that they just sometimes do it. I will fight that on my insurance claims because I am not paying for a test that I do not need. I'm not paying for a pregnancy test. You know good and well that I am not pregnant, that I've had all this stuff. I'm not paying for that test. You can forego that money. But anywho, so that was some interesting stuff there. Okay, so I could not find the other one. It was probably just a lab number that has nothing to do with that particular one I was looking at. A bunch of labs. But today we're going to do, usually we do a quote of the day, but we're going to go to a quote not to live by. And it is, I'd rather wonder than get an answer I couldn't live with. And I think that is how Owens wants to live her life. She doesn't want to go get these ultrasounds. She doesn't want to seek prenatal care with any of these HCG tests, because then she's going to get an answer that she can't live with. And as long as she buries her head in the sand, then she gets to continue to wonder and wish upon a star. And that is no way to live. You need to get answers. You need to ask the questions. You can't do that. And that's not healthy for a baby or a pregnancy during the prenatal time anyways. But get the answers. Ask the questions. Stop just being well, I had the test, but, if I would have actually gone and questioned the stuff, then I would have had the answer that I didn't want to live with. And that meant that I wasn't pregnant with Eckerd's twins. It means I wasn't pregnant by Maraschini or Gillespie or Matt or any of these people. And then they wouldn't want to be with me. So I just don't go look for those answers because I know if I actually searched for them, then I just couldn't live with that. So I'm just gonna be over here in my wonderment because she knows good and well she was never pregnant. So don't bury your head in the sand, people. Like, go get answers. Like, deducing things. Like me. If I was, oh, well, I had a positive HCG test. I was pregnant. No, I'm going to need to get some more answers as to why that is. Oh, it could be medications. Oh, I couldn't be pregnant because I've had a hysterectomy. Oh, I hadn't had sex. All these things. I'm not pregnant. That is an answer I can live with. Um, Although I don't think I could live with the I was pregnant. But I always joke that if for some reason I was to end up pregnant, I would sue the living daylights out of people. Wouldn't be all that bad because, well, I would become rich. Um, and they can do a Lifetime movie on me, and I'd have to pick somebody to play me, and I would have no financial stress because I got pregnant when I shouldn't have been. Many steps. So somebody is going to be needing to pay me a penny, and then I can just raise the baby, right? Like, that may be a bad way to look at it, but that's the way I'm going to choose to look at it. Anyways, I know a lot of this wasn't new information, but it was just an interesting take. And if anybody ever Googles, can you get pregnant after a hysterectomy, maybe they'll come across this video. But hit that like button, subscribe. I'm hoping that I can get to Greg Gillespie Part 2 coming soon. And we're going to go over a couple of other emails or documents on certain things. So I will see you in the next video. Wrap it up. Use protection.